Hello, my name is Grant Davis, and today I will be talking to you about the healthcare industry. Basically, a brief overview of the healthcare industry consists of your hospitals, but then you also have service providers that would that basically do your prescriptions and everything the doctor would send into them, service providers that provide technology for the market, sales providers that give you drug information databases, and many other things in that field. So, when looking at what kind of companies, organizations, or nonprofits someone could work at in this field, a great example would basically be database providers, which are mainly right now Reed Elsevier and Wolters Kluwer, along with any pharmaceutical position in a company that they would basically be dealing with, or would need to have some information of that, such as maybe a doctor or a pharmacist. So, when looking at what jobs are like in this career field, basically it would be any job providing care to patients. The highest level would be nurses, doctors, pharmacists working together to help patients. Basically, you have acute care, which is in the hospital, and in there you're running tests in there. Then you would have ambulatory, which is kind of coming in and out of the hospital for care. Basically, if you need drugs, equipment, many companies provide services. McKesson is a great example. They can provide computer-related systems for hospitals. Basically, it's all about doctors and nurses and pharmacists taking care of patients to the best of their ability. So, when looking at what someone does in this career field, basically how they would spend their day, his or her day, it really depends on whether you're a provider with the care system, or if you're doing treatments outside of a hospital, such as like rehab in some cases. You basically have like an example being a physician can work in a hospital. They can even work on a sales team or a content-related company. A lot of nurses actually work with companies that provide services to hospitals. It's very common, as well as they also do work in hospitals. So in reality, it just varies a lot depending on what position and what company you would be working for at the time. So, looking at the challenges that people in this career field are facing today, recently with the passing of the Affordable Care Act, there's been a move for fee-for-service, which an example of fee-for-service is going in, having a test run on you, and paying for it, and maybe doing a couple extra tests and having to pay a little bit more money for that. But basically, the model has been changed to the Affordable Care Act, so now it's quality of care based now and not multitude of test based. So you don't pay based on how many tests you do anymore. You are paying on quality. And so basically that's made a shift, and that's opened up a market for protocols that companies can write and then sell out to hospitals to make their testing more effective and therefore less expensive to them, and allow them to get more money. But when looking at how long this new shift or model will be going is subject to change due to, from what President-elect Trump has said, trying to repeal the Affordable Care Act. So the future of this industry is somewhat reverting back to fee-for-service versus quality-for-service. It's unknown at the time when the shift will happen. The types of majors that people in this field would have, basically, so if you're going to be working on the hospital side, you would need a clinical degree. And a clinical degree would be a nursing degree, some level of a nursing degree, pharmaceutical degree, or a doctorate. But basically, if you're working outside of the hospital area and you're working in a company that would basically provide services to them, the degree you can have varies to an extent where you can't exactly pinpoint a specific one, just due to the variability of having a degree in any field while working in the healthcare industry or as a service provider. The knowledge or skills that would be critical for someone to have in the healthcare field, depending on the part, which basically means if you're doing clinical treatment of patients in a hospital, it needs you would need to have a strong clinical skill set, which is basically you would get that through a nursing degree, pharmaceutical degree, doctorate degree. But then you would have a service portion, but you basically, to simplify it, you would need to understand the wants and needs along with the value that you can bring to treating patients that you provide the service to. So the professional associations are groups that can be associated with this career are, but not limited to, the National Council for Prescription Drug Programs, along with the National Association of Chain Drug Stores, along with the American Medical Association, and any physician trade organization can be counted under this section. So, looking at healthcare industry playing a role in the United States and global economy, healthcare is going to be one of the highest costs of any company due to their employees needing it. But basically, so healthcare insurance. But healthcare in the U.S. market is alone $3 trillion as of a couple of years ago, meaning that it's an extremely large industry and it's never going to go away.